You're listening to episode number 23 of Overprescribed. Welcome to Overprescribed, the show that raises America's awareness on pharmaceutical medications in this country, all in an effort to help you, the everyday consumer, to live the safest, healthiest, and most informed medication experience possible. Hi everyone, I'm your host Mika Pollock, and I have some statistics to share with you. These statistics are coming from childrensrights.org. Children's Rights is a child welfare nonprofit based out of New York. And on their website, they state some of the following with regards to foster care kids and the statistics of foster care prevalence in the U.S. Childrensrights.org says, on any given day, there are nearly 438,000 children in foster care in the United States. In 2016, over 600,000 children spent time in U.S. foster care. On average, children remain in state care for nearly 2 years, and 6% of children in foster care have languished there for 5 or more years. Children's Rights goes on to state that despite the common perception that the majority of children in foster care are very young, the average age of kids entering care is actually 7 years old. In 2016, more than half of children entering U.S. foster care were young people of color. And while most children in foster care live in family settings, a substantial minority, or 12%, live in institutions or group homes. Now, while it didn't happen just this year, it's been going on for some time, recent reports are showing that children in foster care are being over-medicated or under-medicated, or as I like to call, mis-medicated in the foster care system. Per a Salon.com article, there was a report from the Health and Human Services Inspector General's office on foster care children in 5 states. Those 5 states were Iowa, Maine, New Hampshire, North Dakota, and Virginia. And if you're wondering why just those 5 states, I'm going to tell you. Those 5 states were chosen, apparently, because those 5 states had some of the highest number of foster care children who were on psychotropic medications dating back to 2013. Now, psychotropic medications, by the way, we can also refer to them as anti-psychiatric medications or psychiatric medications. But the bottom line is that this study or this reporting focused on looking at foster care kids on psychiatric medications, and those 5 states were of high interest. Now, there was more than one alarming finding from this investigation into those children from those pool of 5 states. But let me start with one of the most striking and most alarming findings from that report. And that has to do with the fact that when it comes to those 5 states, at least 3 of those 5 states had greater than 50% of their foster kids receiving medication treatment without any treatment plan. So what does this mean? I interpret this to mean that there were no procedures being implemented, particularly at the state level, being implemented to ensure medication monitoring was occurring outside of those living in the home for these children on these psychiatric medications. Some of these children being on whether it's one medication or multiple medications. And that's a problem, because documented monitoring of any child on one medication, much less multiple medications, is a must. And that brings me to another alarming finding from this investigation, which was that some children, reportedly as young as 6 years old, were on upwards of 4 psychiatric medications. Now, 4 psychiatric medications is a lot for an adult person, much less a child. Per a Huffington Post article that was published several months ago, And I'm going to quote this article. It reads, psychotropic drugs such as Seroquel, Risperdal are approved by the FDA to treat severe mental illnesses like depression, schizophrenia, bipolar disorder, and irritability among people with autism. For people with severe mental illness, psychotropic drugs can be necessary, even life-saving treatments. However, those drugs aren't approved for conditions like attention deficit hyperactivity disorder or disruptive behavior disorder, the symptoms of which can include outbursts and defiance of authority. And while off-label use isn't illegal, it's not good medicine to administer drugs to treat a symptom like anger or defiance without considering the causal factors of that behavior. And that's from the Huffington Post article that I'll include in the show note links, which is also talking about not just some of the statistics around foster care kids and how they are being, in some ways, over-medicated or mis-medicated in the foster care system, but also talking about medication exposure to migrant children or immigrant children who have been recently detained. In the same article that was published several months ago, there were some other disturbing details about foster care children and their exposure to psychiatric medications. According to the article, while foster care kids are likely to have experienced more trauma, whether that is, I would interpret that to be either emotional and or physical trauma, foster care kids, despite experiencing more trauma, foster care kids who are Medicaid insured are still more likely to be prescribed antipsychotic or psychiatric medications or prescriptions than kids who are privately insured in substantial numbers. As a matter of fact, foster care kids prescribed antipsychotic medications is a number that grew substantially between 2002 and 2007. And some researchers are noting that psychiatric medication should be the last line of treatment for children and not the first, which is apparently not always happening with foster care children being exposed to these types of medications. The Huffington Post article also goes on to state that in the case of foster care, lawsuits and legislative action have proven to be effective tools in fighting the mistreatment of children. Prescription to foster care kids peaked in 2008 after child welfare advocates, federal agencies like the U.S. Children's Bureau and the Government Accountability Office, and individual states like Washington, Texas, and California stepped up, precipitating a shift toward greater restraint. And I think the articles I'm going to include in the show note links are going to be helpful references for you to understand more of the frame of mind behind this issue. But I interpret this as something that needs a broader public health effort from everyday people. And that really will come from adults in this country standing up for kids, particularly foster care kids in the system, and reaching out to our politicians, our congressmen and women, asking them, what are our states doing to make sure that foster care kids are not being mis-medicated in the foster care system? Again, psychiatric medications come with significant issues for just an adult. There's tons of side effects. There's strong medications. And when you have a child whose brain is still developing, whose body is still developing on these really strong medications, and they're being impacted in ways that are not being monitored, that can only be detrimental for the child as well as the family and the home environment. So I think, we need to get behind this. We need to contact our local politicians or Congress people and ask them, what are we doing or what can be done to make sure foster care kids are protected in the foster care system, and there is greater medication management going on, medication monitoring, not just for the 5 states in this government initiated or government led research project, but also greater awareness at the state and local child welfare levels to ensure that all states in the U.S. have strong procedures that are verifiable procedures being evaluated and assessed continuously with strong oversight so that foster care children are not being mis-medicated, particularly in the case of those who are being over-medicated in this country. Thank you so much for listening to another episode of Overprescribed. If you enjoyed what you listened to, please take a moment and subscribe to our show. Also, take a moment and share our show with your friends and family. Spread the word about our show. And if you ever want to talk with us, feel free to email us at talk@overprescribedpodcast.com. That's talk@overprescribedpodcast.com, or reach out to us on Twitter at _overprescribed. Again, you can reach us on Twitter at _overprescribed.